Mr. Raghunath Verabelli, Managing Partner, GGK Tech. He's going to talk to us about data is just the beginning, role of predictive analytics in improving healthcare effectiveness.
I think this is working.
Okay.
So good morning, everyone. Hope you're having good time at this great session organized by Apollo. We want to thank Apollo for giving us this opportunity. This is our first time at this conference. So I'm representing here GGK Technologies. We have been in business for about 12 years, working primarily in US with healthcare providers, payers, healthcare technology companies, developing solutions for payers and for some of the providers like some advanced analytics, predictive analytics types of solutions on the e-prescription side, medication management. So we have done a lot of work there. We are relatively new to India market. We have decided to develop a solution based on our experience in working in other countries. So when we started this, we felt that, we all know that healthcare industry produces more data than any other industries. We all agree to that. But the key thing is, we are getting into this data explosion mode. So the key thing that we noticed, especially in India, and some of this was discussed, I'm glad it was discussed in earlier session today. The key thing is there are no interoperable standards. Whether you take HL7 or whatever type of standards, there are not many vendors following those standards. That was one of the key things that we, including precise data definitions, there's lack of HIT standards, and there's lack of, I would say more like a unified architecture kind of thing was missing for exchanging, for communicating more seamlessly. For us, one of the things that when we work with any clients, we don't want to lock any clients to our software. We want it to be very open. We want to follow the standards so that clients can take and do whatever they want. When in any application that we develop, we have to consume the data, we have to produce the data. We have to work with upstream applications and downstream applications. That's the key thing for us. And we have noticed, there were a lot of EMR, EHR softwares that are available in India. They're not following all the standards. And I'm glad to hear that the NEHA and other government authorities are making a lot of progress on that. Arvind talked about this earlier today. So hopefully we'll have standards very soon and everyone will follow those interoperable standards. Of course, some of the challenges in India is in smaller healthcare facilities or in rural healthcare facilities, we still do not have the required IT structure, IT infrastructure. So we still have to work on that. Also, the last point here is very important is that cooperation among different providers, that freeness to share the information, to exchange the data. That's also we felt was missing based on our experience. Assuming we have data, assuming we have interoperable standards, what are some of the possibilities? Again, this is based on our experience. It's not all possibilities that we are talking about. So one of the things that we were talking about is, earlier we talked about is sentiment analysis. Even if we have scanned documents, from the scanned documents, what we can do is we can have an OCR, optical character recognition kind of a software, which can scan the documents for certain keywords. Based on that, it can pull up some records, and then we apply some NLP kind of techniques on that to do sentiment analysis. So we can pick up the medical records very quickly with negative sentiments. So this is one possible thing that we can do even with the scanned documents. The second point here that I want to mention, this is more on intervention side. And this is happening in US, I'm sure, and this is all based on, see, one thing is we look at the patient's medical history. Based on the historical data, we are looking at the current conditions. But how do we look at the possible future conditions? That's what we are getting into the predictive analytics side of it, right? We know what the patient has, but can we make a best assessment of what patient will have in future? And I'm not going to go into the deep of how this is done in predictive analytics in a limited time here. The data is the most important thing for it, but of course there are a lot of statistical models that we have to develop, and then using some of the machine learning techniques, that's the key thing for any predictive analytics. So one possible solution that, again, this is the solution that we developed in US is, in US we have ICD codes. Based on ICD codes, there are some, if you have like 35, 40,000 ICD codes, they have classified that into few diagnoses, and then they've further classified it into what we call as HCCs, hierarchical condition categories. There are about 70 HCCs. So what they're doing is, HCC is nothing but, just to simplify for your understanding, you can see it's basically, it's prioritizing the relative risks of all diseases. So that's what HCC does. And a lot of this is driven by payers in US, because instead of treating when the patient is sick, they want to treat now. By treating now, the cost is less. So they would like to incentivize the patients to visit doctors at regular intervals, maybe every month. In fact, they give some coupons and things like that. So this is what we meant here by proactive interventions and early diagnosis. So based on this HCC risk adjustment model, what they do is we schedule an encounter. We schedule an appointment with the doctor. So that's the second thing. The third here application that we talked about, patient assessment. This is more at point of care. This happens in real time. So based on existing conditions and the predictive conditions for the future, of course, we do a questionnaire kind of a thing with the patient to make sure that we are confirming some of those conditions. And then based on that, doctor can recommend some procedures. The whole idea at this system is to decide, whether the encounter, at the encounter, whether whatever the prediction that we made, is that true or not. That's what we are trying to do at this third level. The fourth is more like, this is prescriptive analytics. This again, I'm sure a lot of you are familiar with IBM's Watson kind of a software, where it's recommending to add some things to the prescription or remove some things from the prescription. So that's another type of application that we can think of. E-prescription, again, is basically connecting the providers directly to the pharmacies and the labs to avoid any manual errors and things like that. The last here is more of a business intelligence. Assuming we have all the data, we can analyze the patient healthcare based on a region, for a particular population in a given region or a given state, for a particular age category. What is the risk that someone at my age having diabetes coming from certain region, gender. There are a lot of business intelligence type of reports that we can develop based on the data. So these are some of the possibilities. Earlier we had a discussion today, ICD versus the other standards that are being adopted. So I'm sure we can develop models using those codes. So this is put into a diagrammatic representation here, what I just talked about. We have hospitals, clinics, labs, insurance companies. If we have standardized EMR, EHR systems, and they're all getting into this common data exchange here, and if taking the scanned documents, we can do OCR type of things on the scanned documents, and then again use NLP for doing sentiment analysis. That's one possibility. We have e-prescriptions, giving more of prescriptive analytics there. And of course, all of this data can be given to the government for population health management, for research agencies. So, this is just a diagrammatic representation. So, the whole idea is, these are some of the outcomes. Why are we doing? If you have the healthcare data exchange, combining that with power of predictive analytics, the whole idea is to lower the cost and provide better quality of healthcare. That's the whole idea. Again, we are developing all of this for Indian market. We have launched our product yesterday. Sangeeta Reddy madam launched the product. I would like to hear more from you, the opportunities for collaboration. Our booth is in the lunch area, so please stop by, and we would like to talk more from ideas that you have, how we can work together. Thank you very much.
Thank you. Thank you.